without the microphone because this feels more comfortable with me. Is everyone able to hear me all
It
right?
comes off the thing, so you can just carry it.
Okay. Yeah, I can do that then.
Hybrid.
You won't break it.
There you go. All right. Can everyone hear me all right?
Yes.
Stand reading them. There we go.
Hi everyone. My name is Sasha Lewis-Norelle. I am the Environmental Health and Justice Organizer with Clean Water Action Minnesota, and I will be one of the people giving this presentation today. Morgan, you want to introduce yourself and I can say a bit more about clean water?
Yeah. I'm Morgan. I'm the Zero Waste Organizer for Clean Water Action. And yeah, this is my first time giving one of these presentations, so Sasha will be doing most of the talking, but I will be here smiling, clicking the buttons. So thanks for having us.
Yeah, thank you, Morgan, for that help. Yeah, so I think we can go to the next slide. So today we are going to be giving our Healthy Homes presentation, and just a bit about us as an organization, as well as the Healthy Legacy Coalition, which we helped to found. So Clean Water Action is both a national organization as well as a bunch of state chapters. Our national org was formed in 1972 to help pass the Clean Water Act, and we've been in Minnesota since 1982. We also have other chapters in 13 states. And then the Healthy Legacy Coalition is a coalition that we helped to form, which works to address chemical policy in Minnesota and nationwide to protect public health and the environment. Over the last couple of decades, we've learned a lot about just how many toxic chemicals there are out there, all of the health impacts, all the environmental impacts, and a lot of our policy is still lagging behind that science and that understanding. And so there's a lot of need for advocacy, for education around these issues to address them. Next slide. So in this presentation, we will cover a few different things. The first is how these chemicals are getting into our home and our environment in the first place. The second is the ways that these chemicals impact health and the environment. The third is how we are working with coalition partners and legislators and lawmakers to address these issues. And the fourth is how you can advocate for yourself to get these chemicals out of your home, out of the environment, out of the products that you use. So these are the main types of toxics that we will discuss today. We'll do BPA, vinyl, PFAS, microplastics, and lead. There is also a decent amount of information here, so I'm glad that we are recording it, and also we will have hopefully room for questions at the end. So be sure to remember any questions that you have. So looking at how these chemicals enter the environment and our homes, there's a few different ways. One that's very common is just runoff. So you might have heard that in the context of like agricultural runoff, for example. A lot of farms will use like pesticides and things like that on their plants to get rid of insects. And then when it rains, the water comes down through those crops and picks up those chemicals, bringing the chemicals into the waterways. That's a really common issue that brings a lot of chemicals into our water. But pretty much anywhere that there is this kind of, these toxic chemicals being used, where like water can come in and pick them up, it can leach into like the groundwater that way. Similarly with like landfills, for example, there's a lot of products in our landfills that have toxic chemicals, and again, the rain comes down, picking up the chemicals and bringing it into the groundwater. There's also issues around air pollution, for example. One example that's particularly prominent here in Minnesota is solid waste incineration. We have a number of waste incinerators here in Minnesota, and the air pollution from that has a lot of the chemicals that are included in the products that they're burning at those plants. And again, that waste or that pollution is picked up by the rain and deposited into our waterways and into the groundwater. There's also direct dumping by individuals and industries. Unfortunately, a lot of our regulations in this country have not necessarily done the best job of protecting our waterways and our environment from companies that are dumping, and some of them also will dump illegally or try to avoid all of those regulations. There's also a kind of unique issue that private wells have because they are primarily with groundwater. So examples like leaching from landfills, or I know there's a lot of issue with like nitrates, for example, in greater Minnesota that's used in like agriculture, and then that gets into the groundwater, and then it's picked up by the wells. So there's issues there as well. But yeah, these are some of the main ways that we see these chemicals enter our environment, and then we'll also get into some of the products that are also containing these chemicals, which then impact our health. So looking at the first chemical, we're going to be talking about BPA, which is a hormone disrupting chemical. And a lot of these chemicals are most impactful on children, infants, pregnant people. That's kind of the ways that these have the largest impact. Most of them can still have some level of impact on adults, but the priority is generally to really make sure that children and someone who's pregnant are not interacting with these chemicals to keep them safe. So BPA is linked to a number of different issues such as early onset puberty, childhood obesity, and cancer. A lot of these are harder to draw a direct causation, but it's a lot of correlation. So if someone is exposed to these chemicals, they have a higher chance of developing cancer or having issues with childhood obesity or developmental issues. BPA is used a lot in polycarbonate plastic number 7. How familiar are you all with kind of the plastic numbering system? Okay, so a bit of context. Basically, the plastics industry did some both advocacy and kind of intentional misleading with the way that they label their plastics. So you might have noticed that on plastics that are labeled with kind of the little symbol, like the triangle symbol with a number in the middle, it's made intentionally to look like the recycling symbol, even though a lot of plastics, the majority of plastics, are not actually able to be recycled effectively. And so the plastics industry wanted to make it seem like plastics are a lot easier to address than they actually are. But also the labeling helps to indicate what kind of plastic you're dealing with and the impacts that it might have. So it generally goes 1 through 7, with plastics 1, 2, and 5 tending to be the most recyclable and generally the least impactful. And then plastic 7 here is an example that uses BPA oftentimes. And you might see this in things like shatterproof windows, eyewear, water bottles, and epoxy resins for coating certain things. I actually had an old water bottle that specifically said BPA free on it because it's now known as an issue that some of our products contain these chemicals. And you can oftentimes look for some of these labels to see if a product is BPA free or free of some of these other toxics. The next chemical is vinyl, and this contains a chemical known as phthalates, which has been banned from children's products since 2009 because it has such impacts on health. It is another hormone disrupting chemical that is linked to reproductive and respiratory issues. And here you can look for the number 3 on plastic or the word vinyl on packaging. It's used in things like roofing, siding, flooring, windows and doors, and wall covering and fencing. So if you can avoid using those, that is generally the best. This is a big one. Have y'all been hearing news about PFAS in Minnesota over the last year or two? Okay, yeah, so one of the reasons why it's important here especially is because Minnesota is the home of PFAS. 3M is the company that first developed this class of chemicals, which is why it's so important that we are now, as a state, being the leaders on addressing this issue. So PFAS, also known as forever chemicals because they never break down naturally, is a class of over 5,000 human-made chemicals, and they are used in a lot of consumer products. The reason they were made is because they have a lot of really useful properties, but they have also been linked to a lot of health issues that I'll get into in a second. But some of these properties include grease and oil and water resistance, and so you see them a lot in food packaging or sometimes certain kinds of clothes, or a lot of different products contain PFAS, and we'll talk a bit later as well about what Minnesota has done to address this, but in general it's a very broad category that has a lot of health issues, and thankfully we are now starting to better understand the challenges with it and how to address it. So getting into some of the actual impacts of PFAS, it's been linked to a number of different health issues such as testicular and kidney cancer, a lot of different diseases up here that I won't read all of them, but essentially it's been linked to a ton of different health issues, and again, this is one where it is especially impactful on younger children, but pretty much anyone can have the health impacts of PFAS. And one of the challenges is that they are very persistent. Again, they're called forever chemicals, they don't break down, and so once they get into our environment, they can last a really long time, and that makes exposure to it much more likely as opposed to some chemicals that can maybe get into our environment but could disperse more naturally. And they can also accumulate in the human body because they're not breaking down there either. So if you're exposed to PFAS over a long period of time, that can also have a larger impact. Have any of you heard the story of Amara Strandy? Okay, so for context, last year Minnesota passed a whole suite of PFAS legislation. Clean Water Action played a pretty big role in helping to pass that. And one of the big reasons why this was such an ambitious undertaking was because there was a young lady named Amara Strandy who was an advocate because she had a very rare form of cancer that was actually caused by PFAS exposure in the East Metro in St. Paul. And I think she was one of 2 people in the state that had ever gotten this kind of cancer. And again, it was pretty clearly linked to PFAS exposure. It's around where 3M had been basically dumping PFAS chemicals into the land for years. And the school that she went to was actually kind of infamous for having a number of cancer cases, like an abnormally high number of cancer cases. And Amara actually passed away, I think, 3 days before the PFAS legislation passed the legislative session. And so she did an amazing job being an advocate. She got herself to the Capitol, or she was able to go to the Capitol to advocate in front of committee, tell her story, share her personal experiences while she was sick and dying. And so anytime I talk about PFAS, it feels really important to share that this is impacting people, it's impacting lives, it's impacting families, and this is why we work so hard to both educate people, but also to change things at the higher level so that people don't have to live their lives in fear of being exposed to these sorts of chemicals. So another one that I think most people have heard of is lead, which is another cumulative toxin, which means that once it gets in your body, it doesn't really go away naturally very much. And so the more lead that you take in over time, the more it accumulates and the higher impact it has. A common phrase among those who work on lead issues is that there's no safe level of lead. Any level is going to have an impact. And again, while it's one that has most of an impact on children, infants, and pregnant people, it is still something that is a concern for others as well. It's distributed to the brain, the body, the kidney, bones, blood. It is very invasive in our bodies, and it's usually assessed in terms of elevated blood lead levels as an indicator of how much lead is in your body. So the lead can get into your bones, which is then released into the blood, and that becomes a potential source of exposure for a fetus if you're pregnant, for example. And again, there's no safe level of lead, and there are at this point 3 main sources of exposure that I'll get into in a second, but there's soil, paint, and pipes, and then gasoline was a much bigger issue a couple decades ago, and I think it's still being used in commercial airlines, but in terms of cars, for example, leaded gasoline has been banned for a number of years. So getting into some specifics, lead paint is a big one. Houses built before 1978 oftentimes contain lead paint because that's when lead paint was banned. Lead is another one of those chemicals that kind of fits this theme of it was seen as very useful, very helpful for a lot of different products. And so it was used in a lot of different products, and now we're finding out more about the health impacts and figuring out that we actually have to address all of these legacies of using lead in way too many things. So a lot of these houses will contain lead, and there are some thankfully pretty easy things you can do around lead exposure. So for paint, you can test your wall. A lot of hardware stores have at-home lead paint test kits you can get for $10 or so. It's pretty easy to test that yourself, thankfully. And again, if your house is built before 1978, then you could also just assume that there probably is some lead, even if you've painted over it within that time. It could still chip off and reveal some of the paint underneath that still has that lead. It's oftentimes, especially coming from window frames and sills, where the paint is chipping a lot more often. And so if you either have tested it and you know that there's lead paint, or you're concerned about that, then there's things you can do like cleaning up the peeling or chipped paint that you might see around your house with a wet paper cloth. You want to avoid doing a dry paper cloth because that could disturb some of the dust in that area and move it around the air and make it so you're breathing it in. And then whenever you're doing repair or major renovations on your home, you would want to look into getting a lead certified contractor who can safely deal with lead and make sure that when it is disturbed when you're doing those renovations, that it's not causing unsafe exposure. And the Minnesota Department of Health has a lot of information on lead, including a list of lead certified contractors. Another big one that has been getting a lot more attention recently is lead in water. So a couple years ago when Congress passed the Infrastructure Investments and Jobs Act, that included a lot of federal money for replacing lead pipes, because a lot of times the pipes that bring the water from the street line to the house were made of lead, also known as lead service lines. And so a lot of these houses as well that were built before like the 70s or 80s will have a lead pipe. And this one you generally have to contact your water service provider to get it tested. But again, if your house is built pretty much before the 70s, there's a decent chance that your pipe is a lead pipe unless it was replaced by a previous owner or you replaced it yourself. So if you have lead pipes, then you can do some things like using cold water for cooking, because warm water is more likely to erode the pipe and bring along some of the residual lead. You also, if the water's been unused for a certain amount of time, so especially after and like overnight, you can run the water for a couple minutes and just let the lead contaminated water go through, and then the rest of your water will be more safe to use. And then every month or two, taking out the faucet aerator, kind of a little bit at the end of the faucet, and cleaning that out can be helpful as well, because that is another place where lead can accumulate. And Minnesota also last year passed a ton of money to help replace a lot of these lead pipes as well, to build upon the federal money. So if you live in an area that has lead pipes, then you might be hearing from your water service provider about programs to replace those lead pipes. And the reason the state passed that money is to make sure that this replacement is happening free of charge as often as possible, because replacing a lead pipe can be very expensive. It can be over $10,000 in some different areas. And so if the state and federal governments can help address this issue and keep our health safe, that is just a lot better. All right, and then microplastics. I'm sure you've heard some about that as well. It's defined as small plastic pieces that are 5 millimeters or shorter, and those can be harmful to both our health and the general environment. I'm sure we all know that there is a lot of plastic in our oceans, there's a lot of plastic in our landfills, there's a lot of plastic everywhere. Microplastics are kind of emerging as an issue of concern more recently, as it's been found in so many different places, pretty much every part of the human body, everywhere in the environment. I think there was even a situation with they found a plastic bag at the bottom of the Mariana Trench or something. Plastic is getting everywhere in our world. And they're starting to find more health impacts from microplastics as well. And because plastic is such a broad category, it's hard to say there's this specific health impact from plastic in general. It's more so what kind of plastic caused the microplastic that might cause a health impact. But as we went over earlier, there are some general health impacts from BPA, vinyl, all of those things. And so the more we can address microplastics and plastics as a whole, the more we can keep ourselves and our environment safe.
Also, just really quick, this image is a little misleading. These are probably not microplastics. What we're talking about is super, super tiny, even smaller than what the human eye can see, and that's the stuff that is able to kind of absorb into our body and into the environment.
So again, it kind of depends on the source of the plastic, but there's going to be a variety of health impacts on our hormones, our reproductive systems, our bodies in general, and we're still learning a lot about the health impacts of plastics and microplastics. So the sooner that we can address this issue, the safer we'll be in general. So now we want to get into some of the steps that you can take to reduce your exposure, because it's not great to just give a presentation that's everything is horrible and there's nothing we can do about it. So let's get into that. So the first is just having a general understanding of kinds of products that are going to usually be safer. So if you're able to, prioritizing products that are made of wood, cloth, glass, and stainless steel, especially over plastics and other synthetic materials, is always going to be best. Just last year, I actually got a really nice stainless steel cooking set, and it took some getting used to. It's definitely different from what I was used to, but it's also nice to not worry about scraping it a bit and worrying about toxic chemicals getting into my food. So yeah, just this kind of understanding is really helpful as a frame of reference for when you're buying products in general, and especially if you're buying something that a child or infant might be using. Food safe packaging is a big one that we're still working to address, but have also made some really good progress on. And so a lot of food packaging products use PFAS, for example, because again, it's very useful as a chemical or as a class of chemicals. But Minnesota actually passed a PFAS packaging ban, which as of this year is now in effect. So companies cannot be intentionally adding PFAS to food packaging that is going to be sold with products in Minnesota. We'll get a bit more into some of the other steps that we've taken as well, but thankfully we're doing better when it comes to food packaging. In general, if you can avoid, again, like plastic or other synthetic sorts of packaging, that is best. And buying like fresh or frozen and dried food, avoiding canned food that has a BPA lining, which, as I understand, is a lot less of an issue these days, but you can again look at a can and see if it says BPA free to look for that. And then if you're able to use like Tetra Paks or glass jars, that's another way to like store food. That's a lot safer than just keeping it in a container of plastic. Flame retardants is an interesting one because, like, at least growing up for me, it was like, oh yeah, we want to prevent fires. That seems really helpful. But in actuality, one, flame retardants do have a lot of health issues, and two, they're not that effective at stopping fires. The reason why they're so common is, I'm sure as some of you would understand, smoking indoors used to be a lot more common, and so there was a lot bigger concern that fires could start, and so they included a lot of flame retardants in like furniture, for example. But there are definitely some health impacts that have been connected to that, and so it's generally best to try and get like furniture that does not have flame retardants. This year, actually, Minnesota also became, before this year, Minnesota was one of the last states to not have a ban on flame retardants in tents, because again, it doesn't really actually protect the tent from fire, and it just means that people are sleeping surrounded by a bunch of toxic chemicals. But we thankfully were able to pass a bill this year to make that ban happen, and I think New York is like the last state in the country that has not enacted a similar policy. And so with flame retardants, again, on furniture, you can look for that tag that says doesn't contain flame retardants. And if you don't see that tag on your current furniture, or you're worried that it might have flame retardants, then just like washing your hands frequently, especially with kids, which is also just general good practice, especially with kids, can help avoid some of that exposure. And yeah, just being aware of it is kind of the first step, as with a lot of these chemicals. Personal care products is a really big one that I won't go super into, especially because there are a lot of resources that are helpful for this. Walmart actually recently created a clean list that basically is a bunch of personal care products that do not have toxic chemicals that people would be concerned about. So that could be one resource to look into further at some point to just see what kinds of products are generally better there. Skin Deep also has a database on ewg.org that also has a ton of information on what kinds of products or what brands of products might be safer than others. In general, you also want to avoid like artificial fragrances and antibacterial soaps if you can, because those contain triclosan, which is a hormone-disrupting chemical. In general, a lot of these products that use like really strong fragrances are using some kind of chemical to achieve that. And I know it's hard to avoid in all of this, which is why it is helpful to have these databases that can tell you which might be safer, but that's just kind of a general rule of thumb for some of this. And then there's also cleaning without chemicals. I know it can feel easy to just like go to Target or Walmart or wherever to just get what's off the shelf. And there are definitely some safer brands. I think last time I looked it up, 7th Generation was actually one of the safer brands that tends to do a lot better with like these websites that review how healthy these products are. But if you can, there's also a lot of resources for making your own cleaning products, and it can actually be pretty simple. So yeah, I would say look into some of those. There's like, substituting vinegar or baking soda for some of these harsher chemicals that you might use. And then whenever you're cleaning, especially if you're using products that were store-bought, making sure there's good ventilation. A lot of this comes down to indoor air pollution and just like breathing in the chemicals that you've been spraying around or from the products that are in your house. And so if you can ventilate while you're cleaning, using gloves and eye protection, all of that stuff will help reduce some of your exposure. Also, how are we doing on time? I want to make sure that
You've got about 3 or 4 minutes.
all right, I'll speed through this next bit then. So like I said, indoor air pollution is definitely one of the big concerns. So since we're talking about products that are inside your house, that is where you want to be really mindful of what you're using, and you do best to like ventilate and just make sure that there is a lot of fresh air in your space that is natural, not just a product that says that it's creating fresh air. I'll just skim over this quickly, but essentially because of the health impacts and the cleanup costs and all of that from these toxic chemicals, a lot of these chemicals are costing the economy as well. Like, it's not a lot of it is companies profiting off of using cheaper chemicals, or just using chemicals that are easy for them to make, even though there are downstream health impacts and environmental impacts that they are oftentimes not accounting for. So one of the things that we're trying to do is hold a lot of these corporations accountable for the impacts of what they have done in the past and what they're currently doing. So I mentioned some of this, but we have, as a state, been making some really good progress on some of these issues. For example, we've banned formaldehyde in children's body products. We have banned a lot of flame retardants, including, again, what I mentioned about tents. We also have some really strong legislation that's passed on PFAS. So I believe by 2031, basically any non-essential uses of PFAS are banned. There are some situations where, like, medical equipment, for example, has like an essential use of PFAS that they can't substitute with something else. But if a product can replace PFAS with another chemical and they still want to sell it in Minnesota, they would have to replace it by 2031. We also have a number of specific bans, such as PFAS in food containers, and I forget the specific 11 consumer item categories, but essentially we're making some really good progress. Minnesota is basically leading the world when it comes to addressing PFAS, which is really cool. And it's largely because of a lot of this advocacy from orgs like us, but also people like Amara Strandy and her family and her friends who came together to tell the legislature that this is a serious issue that has affected their lives and is going to affect many others' lives. So we have a few current goals as well to continue addressing some of these issues. One is repealing the plastic bag preemption. So essentially, I think in 2017, the state passed a law that says local cities and counties cannot enact their own plastic bag bans in response to Minneapolis banning plastic bags in retail stores. And so we want to repeal that and basically say it should be up to local governments to decide whether or not to ban plastic bags. We've been talking a lot about health monitoring as well for people who have undergone health impacts from these chemicals, and just making it so that it is easier to track those impacts and make sure that people are supported throughout that as well. There's also toxics in cosmetics and period products that we want to keep addressing, as well as toxics in plastic packaging. We had a bill, I think, last year that was going to address that, but unfortunately didn't have enough support at the legislature to fully get that through. But we're continuing to work towards addressing plastics in general as a huge category, but also toxics as a way to start reducing some of the harm. So here's just some quick steps of how to kind of support this and join in. One is always contacting your lawmakers and just telling them, hey, I care about this issue. You don't have to be an expert on it. You can just say, I heard some things about this. Are you working on this? I would like to see some, like the state legislature take action on this. Or you can even contact your member of Congress and say, this is a concern. What is Congress going to do about this? There's also talking to your neighbors, friends, and family. Just sharing information that you heard at this presentation, or doing research yourself, or finding resources online. It's always helpful to share that around. And if anyone else is interested in getting this presentation, we give it for free. We're always happy to give this presentation to others that are interested, so feel free to share information about this. And then starting small, looking at one habit at a time that you can change, and just finding a way to consistently do that. It's a lot better to consistently do something than try to do a bunch of things all at once, do it for a couple weeks, and then get back to your old habits because it was too much to try and make that big change all at once. And yeah, here is our contact information. If you have any follow-up questions, or if you would like us to do a presentation for another group, or even just like a couple of neighbors that you have that want to learn this information, feel free to reach out to us. And any quick questions? We also will get to the bags because you might have been wondering about those, but we can take maybe a few questions and get to that.
Where does the United States kind of rank compared to Europe? I know our food chemicals are exponentially higher than Europe and some of the other countries. What do we kind of fall in the same bad scorecard with these chemicals?
You wanna?
Yeah, I would say we are very far behind in a lot of ways. I think, like we mentioned with PFAS, I think that's an exception. But yeah, we have a lot of work to do and are looking to what people are doing in other countries as well to see if something like that would work here. But
Are you
there's a lot of
available
work.
to get questions afterwards too?
Yeah.
Oh, give them a hand. That was a committed